In part 2 of the shoulder pain series, we'll look at these 6 topics. I'll also briefly talk about a technique that's particularly effective in treating frozen shoulder. It's called the Neil Lasher technique. If you suffer from frozen shoulder, please pay attention to this part. This presentation is especially for you. Have you ever seen those commercials on TV where they put food or clothes in a plastic bag and then suck out all of the air? This is called shrink wrapping. Well, the same thing happens with a frozen shoulder. The shoulder capsule is like a balloon filled with water. The shoulder joint is inside this water-filled balloon. When you have a frozen shoulder, the water gets drained out of the balloon. With all the water gone, the empty balloon becomes smaller and it tightens around the shoulder joint. And just like on TV, the shoulder joint becomes shrink-wrapped. This makes it impossible to fully move your shoulder. In fact, it becomes very painful to even try. Because the arm can't move, scars can now form inside the joint. Scars that are inside the joint are often called adhesions. Research has shown us that when a joint is injured or functioning improperly, the deep muscles that surround that joint start to waste away. The muscles can become much smaller and much weaker very quickly. Now let me be clear about this. The muscle doesn't disappear. It just gets so small that it barely functions. The result of muscle wasting is that you feel pain, and it makes your shoulder joint very unstable. When this happens, you need to do specific exercises to rebuild these small, wasted muscles. In fact, some of your pain may linger for years until these wasted muscles are strengthened again. Your bursa is a small sac filled with fluid. It acts as a cushion between the tissues so they don't rub on one another. The term bursitis means that this sac is inflamed. Bursitis, or inflammation of the bursa, is a common diagnosis, but many times it's just not all that important. I'm not saying the bursa doesn't get inflamed. It does, and often. But the point to be made here is that if you have bursitis, it's usually a result of something else. In other words, bursitis is not your problem. Cure the problem, and you cure the bursitis. Simple. To protect the organs in our chest, we have many ribs that form a cage, our rib cage. Ribs have many joints, and that allows the cage to bend and twist as we do. In 25 years of practice, every frozen shoulder I've treated had stuck ribs. Just like peanut butter and jelly, they go together. With a frozen shoulder, stuck ribs cause pain at the blue areas. The neck always gets stuck on the same side as the frozen shoulder, about halfway up, and this causes you pain at the red area. So in addition to pain in your shoulder joint, you will have pain and spasm at the colored areas. These colored areas must be gently moved. This decreases your spasm and decreases your pain quickly. You know, it's common to hear people say, "How could I have a frozen shoulder? It started for no reason." Well, you may find this hard to believe, but it's true. About 60% of the people with frozen shoulder can identify a cause for the condition. For the other 40%, the cause is a mystery. But frankly, it doesn't matter what the cause was. Once you have it, the treatment is the same. Locate the involved areas of the shoulder and treat them with the appropriate techniques. One of my approaches to frozen shoulder is the Neil Lasher technique. Frozen shoulder is a horrible condition. I know. I had it. I'm directing this to my fellow sufferers out there. Please don't despair. These techniques work exceedingly well for 90% of you. People with frozen shoulder suffer. In stage 1, they live with tremendous pain, 24 hours a day. It seems to follow them everywhere they go. And forget about sleeping. The pain seems to get even worse at night. They become exhausted, and their relationships suffer. People with frozen shoulder desperately want reliable, easy to understand information. But most of all, they want relief. If you have a shoulder problem, and especially if you suffer from frozen shoulder, I strongly encourage you to visit the frozenshoulder.com website. It's among the most informative out there, and you can take a brief test online to discover which shoulder condition you probably have. The test is free, and the information, well, it can be liberating. There's much to say about the condition called frozen shoulder, and soon I'll be offering a more in-depth presentation on this topic. For now, just know that you can be helped, and quickly. We have much to do in today's world, and usually too little time to do it. This treatment technique fits into today's busy schedule beautifully. Only 1 or 2 treatments per week are required. Between appointments, you must perform exercises that are appropriate for the stage of frozen shoulder you are in. And I can't stress this strongly enough. Stage 1 exercises are completely different from stage 3 exercises. There's an important point I want to make here. Painful stretches are not necessary. They're not necessary for you to do, and they are not necessary for your therapist to do. In fact, they can tremendously increase your pain and greatly delay your recovery. Bottom line, do not do aggressive, painful stretches. Do you suffer from shoulder pain that's getting worse or just won't get better? Do you find it difficult to comb your hair or reach for your wallet or fasten your bra? Does reaching for something in the back seat of the car or bumping your shoulder cause you paralyzing pain in the front or the back of the shoulder that can last 2 or 3 minutes? Have you tried treatments that are so aggressive, so painful, that just the thought of your next appointment literally makes you shake with fear? From the many stories I've heard, you are not alone. Perhaps you should consider an approach that combines comfortable, soft tissue techniques with gentle, pain-free adjustments. This is the approach I take with my patients. Call and set up an appointment for treatment. It will surprise you just how good it feels to feel good.